Good afternoon. On behalf of Wockhardt Hospital, Center of Bariatric and Metabolic Surgery, I welcome you all for this live chat. Let me quickly introduce Dr. Ramen Goel to all of you watching us. Dr. Goel is a highly qualified and super specialized gastrointestinal surgeon who is amongst the pioneers of laparoscopic surgery in India. Dr. Goel has conducted more than 2,000 laparoscopic bariatric surgeries in the last 16 years. He has more than 25 years of experience in laparoscopic surgery, and he has published many publications in blind peer-reviewed journals, all of which have high impact factor international journals. He's also on the editorial board of some prestigious journals. Dr. Goel and his team welcomes you all, and we're sorry for the delay, but without taking much time, we would quickly like to take up questions so that we can make best use of everybody's time here.
So today we are basically going to cover bariatric surgery and how it affects human patients' lives. So if you are logged in, then please send your comments and we will try to accommodate as many questions as possible. So basically bariatric surgery is a surgery on the stomach, which is inside, and that we reduce the size of the stomach. The concept is that a stomach which is about a liter of size in an adult, after surgery is reduced to about 100 ml or even less, say 50 ml after the surgery, so that it's like a child's stomach. So the patient eats a very small meal and feels full, and thus if the calorie intake is reduced, they lose weight from all over the body. So these surgeries are done laparoscopically or through keyhole route, and generally are of half an hour to 1 hour duration, and that leads to lifelong benefits in terms of weight loss, in terms of disease control, in terms of quality of life improvement. I have two patients with me who are conducting this program today. So let me introduce you to Shireen.
Hi.
Shireen had this surgery few years back and has been happily living and also working with us now in our hospital as a counselor, and she would share her experience, and by the time we'll like to have your questions.
I underwent surgery 3 years back. I lost about 60 kilos, and when I was obese, I obviously did not have any confidence in me. I was pretty low. I used to doubt myself at every step, but after the surgery I'm quite confident. I would never find clothes my size, but now I can go step into any shop and they would say that you are a size smaller than I always ask for, and I'm pretty happy with the surgery.
So that's how it makes change in individuals' lives. Now bariatric surgery is definitely not a cosmetic surgery. So what we do is that we reduce the stomach inside, and we do not touch the skin, we do not remove the fat from body, and the fat is lost from all over the body when the person is eating less. It's just like going on a prolonged diet without remaining hungry, without avoiding the foods you like. So
Yes. Sorry, the first questions come here, doctor. People want to know why going for a surgical approach? Why a surgery for weight loss? That's the first question.
All right. So primarily the thing is that the surgery is done because with diet also anybody can lose weight, but it's not possible to maintain that weight in most of the patients. So those who are morbidly obese, or those who are say 25 to 30 kg overweight, they can lose weight, but almost more than 90% of them will regain weight. While after bariatric surgery, most of them are able to maintain weight even after 10 years or long term. And that is why surgery is required. And the weight loss after surgery is very different than the weight loss after dieting. They are actually entirely different. The mechanism is different. The hormonal changes which happens after surgery are reverse of what happens in dieting. So after dieting, people have a tendency to gain weight, while after surgery, that tendency is reduced and the patients are able to maintain weight.
There's also a supplementary question to that. What is the suitability criteria? How does one decide whether he or she is fit for surgery or the person should do a surgery? Is there any criteria?
Yeah, so basically this surgery is offered for people who are at least 20 to 25 kg overweight. And there are definite criteria in terms of BMI, but usually people who have diseases associated with them, like diabetes, like sleep apnea, like PCOD, blood pressure, these are the people where we offer surgery at a lower weight also. So if somebody is say approximately 20 kg overweight, we can offer them that surgery if they have diseases. And if they do not have diseases, then another 5 to 10 kg extra. So in BMI terms, with this body mass index, it's 37.5 if they don't have disease, or 32.5 if they have associated diseases.
So now the next question we've received is, what is the difference between a cosmetic surgery and a weight loss surgery?
Cosmetic surgery works at the skin level. Even a thin person can have cosmetic surgery. So let's say a liposuction, which is done for fat removal. Now it is done primarily to remove fat from under the skin. And that is only a temporary weight loss measure. Even if say 4 kg of fat is removed from one part of the body, it is likely to come back somewhere else because the patient continues to eat the food the same way as they were doing before liposuction. But after bariatric surgery, the weight loss happens everywhere, and that's why it's very uniform, very long term, and it's more acceptable to the patient.
Okay.
Yeah, what do you got a question?
Yes, doctor. People want to know that does bariatric surgery also cure other kinds of diseases like diabetes or any other ailments?
Yeah, definitely. I mean, this obesity is associated with almost 65 types of diseases, which even includes cancers. So when surgery is done, there are direct benefits in certain diseases like in diabetes, like in polycystic ovaries, and there are indirect benefits when the weight loss comes down, like in joint pains, back pains, like in blood pressure. So it helps in control of most of the diseases that are associated with obesity.
But is there a higher risk for patients who are diabetic and who want to undergo this surgery?
No. So almost 30% of our patients have type 2 diabetes, and they come for treatment of diabetes. So the risk is not more. Only thing that is required is that they are prepared well before surgery. Yeah.
Yeah, I received a question. How long does the surgery take?
It depends. Typically, the commonly done surgery, which is called sleeve gastrectomy, takes about 30 minutes. But the time is not an issue. It's done under general anesthesia. The important thing is how safely it can be done. So typically, surgery takes from half an hour to 1.5 to 2 hours. Yeah. Any other question?
Yeah. If one is having BP, can the patient undergo surgery?
Why not? I mean, almost 50% of the patients would have high blood pressure before surgery, and but if patient knows it, patient is already taking medicines for it, so patient is a well controlled BP patient, and they can be offered surgery. No doubt.
Another question we received is, how to lose weight with surgery, is it safe?
How to lose weight with surgery? As I explained, we reduce the stomach size to a very small size. So if it was 1 liter before surgery, then after surgery it's only about 100 gram or 50 gram. So patient eats a very small meal and feels full as if he has eaten 2 plates full of meals, food. And that's why the calorie intake is so less, and they lose weight from all over the body. Now, how safely did they say?
Yeah. How safe is it?
Surgery is bariatric surgery over a period of time. We started doing these surgeries almost 16 years back, and even during this duration, it has improved significantly the safety outcomes. So now we have published our results very recently, and it says that the risk is about 0.05%, which is as high or as low as a hernia surgery. So I don't think bariatric surgery should be considered unsafe if it is done in a proper hospital with proper precaution and is supported by a complete bariatric team.
There's another question for us. Can a person gain weight post bariatric surgery?
Okay, so weight loss or weight regain are all related to what the person is eating. So if the person is eating fried foods, person is eating sweets, it's possible to gain back 4, 5, 10 kgs weight. But if the person is careful, because even after surgery, in most of the surgeries, patient is eating a small portion per meal. It's not like having 6 slices of bread or 4 slices of bread. Generally, patient even after 2 years eats 2 to 3 slices of bread. And if the person is not eating rich food, weight regain should not happen. So it's extremely few patients where there is a mechanical failure of surgery. Otherwise, most of the time patients will not regain weight.
So we have another question. Can I undergo surgery if I have a heart disease?
Heart disease has been seen to improve with bariatric surgery. So there are published studies, and even we have operated on some very high risk heart patients. Unless somebody has a coronaries blocked, so if there are blood supply, like what causes a heart attack, if coronaries are blocked, then naturally bariatric surgery should not be done, and the patient should be going to a heart specialist first. But if there are other issues like a heart failure or a valve failure, then surgery definitely can be offered safely.
Other abdominal surgery procedures in the past?
Yeah, that's not a problem. Most of the abdominal procedures are in lower half of your abdomen or lower half of the tummy, and bariatric surgery is done in upper half. So a very large number of patients have undergone 3 to 4 surgeries earlier, caesareans or a hernia surgery or a gallbladder surgery, and we routinely do it. So I don't think that should be a reason not to get the surgery done.
What are the risks associated with bariatric surgery?
Okay. Your risk of surgery will depend on the time duration. So early part after surgery, the risk could be related to surgery itself. That's like having bleeding during surgery, or that's like having infection during surgery, or it could be even a leak from the staple line that we have created. But most of these are avoidable and requires not only surgeon's skill but also patient's compliance. So if patient follows up in the right manner, eats the food in the right manner, possibility of something going wrong is extremely remote. Long-term risks are more in terms of having enough nutrition. So after surgery, we want you to eat better food items. We want you to, if you're non-vegetarian, eat non-veg every day, eat non-veg 3 times a day, because you get good quality protein from that. Or eat vegetarian proteins from vegetarian sources, and then have maybe 2 to 3 tablets of vitamin every day. Now, if that is done, then nutritional risks don't arise.
Are these surgeries reversible?
Most of the bariatric surgeries are reversible, but I have never seen, we saw a few patients who came for reversal, but generally nobody wants it to be reversed, because these people have gone through such difficult times when they were morbidly obese or significantly obese that they don't want to go back to that phase. Rather, it happens if somebody puts on 7-8 kgs, they are already talking that can we have a second surgery. So they do not want, nobody ever wants a reversal. But theoretically, yes, except sleeve gastrectomy, all other procedures are reversible.
Can any aged person undergo surgery?
Yeah, so typically these surgeries are offered between 18 to 70 years of age group. But then we have increasing number of young kids who are getting obese, at 13 years, 14 years. So we do offer these surgeries to those also as an exception. And similarly, we also operate people who are above 70 years as an exception, who are otherwise fit and are suffering because of obesity. Yeah.
There's another question. When can I get pregnant after bariatric surgery, and will it affect the health of the baby?
Okay, pregnancy is a much discussed issue in bariatric surgery. Every patient who is coming with their daughter or a son who is likely to have a child is extremely concerned whether it will affect the pregnancy. No, it can only affect the pregnancy in a positive manner. So after surgery, the hormones improve, possibility of pregnancy goes up, the diabetes or blood pressure during pregnancy will not happen, the growth of the child will be normal, and possibility of normal delivery is much higher than a cesarean section. So I think the only statement I can say is that bariatric surgery is very positive, brings a positive outcome to pregnancy. It is advisable that we ask the boy or the girl to delay the pregnancy till 1 year after surgery, primarily because the person is losing weight during that phase. But there are many studies which say that any time after surgery, pregnancy is not a problem.
Could you help us with the exercise protocol after surgery?
Who is asking? You are asking?
We have a question.
You have a question. Okay. So, exercise is not an issue after surgery. We rather encourage person to walk same day after surgery. So, if the patient undergoes surgery is over by 11 o'clock, by 4 o'clock the patient is walking in the room. We encourage them to go for long walks after 10 days. After 20 days they are encouraged to swim if they want to swim, and after 1 month they can join a gym and do body workouts. Only abdominal exercises we discourage till 3 months, primarily because there are stitches and stipples there and we want it to heal. But exercise is not mandatory for weight loss. Even if you don't exercise, you will have the same amount of weight loss what you will have without exercising. Exercise is important even for a thin person without surgery or with surgery, because exercise is required for fitness, and exercise is extremely important to maintain weight long term. So when you talk whether patient can gain back weight, if you are exercising, this possibility is completely avoided.
There's the next question here. Will I need to have plastic surgery done? What if I have excess skin?
Alright, so excess skin is an issue which is related to how much is the weight and what is the patient's age at the time of surgery. So generally young people or people with say 30-40 kg extra weight will not require plastic surgery, they will not have loose skin. But people who are say 100 kg extra, or people who are senior citizen, their skin elasticity is reduced drastically and they may have loose skin. Now there are ways and means of reducing the possibility to have loose skin. If the person is having enough proteins, if the person is having enough water, if they are taking vitamins regularly, if they are exercising a bit, and we getting body massages done, which tones up the skin. So all these together can reduce the requirement of plastic surgery. But most of the people, in our own experience, hardly 1% of the patients ever undergo plastic surgery, because this is only a cosmetic issue. So if somebody has a loose skin, it is either in the tummy or here underarm, and they are usually covered up when you wear clothes. So plastic surgery is not a loose skin is not a health issue. It's a cosmetic issue in certain patients who are, as I said, who are senior citizen or who are say 150 to 200 kg weight.
So we have received a question. How can we connect with you for consultation?
It's all over on the internet, So you can either call up our Wockhardt the call center number, which is in Mumbai, and it's 61784444, 61784444, or you can go on their website and you can book an appointment. So that should not be a problem. Even my mobile number you can trace on the internet. It's all there. Yeah.
In fact, just related to that, the next question is, if I'm interested in weight loss surgery, what is my first step? And after the first appointment, how long will it take for me to have the surgery?
Okay. So first thing is you don't need to come to the hospital for an appointment. We have facility where you can have a video consultation. Because in a city like Mumbai, distances are so much and it's not necessary to just sit across the table and talk to me. You can talk to me on across the screen, and even from other cities person can take an appointment and can talk to me for 15 minutes, half an hour, depending on what slot you want, and we can talk, or we can talk on phone. So a consultation is no more a physical issue. It could be a virtual consultation, so that's not a problem. But once consultation is done, it can take anywhere between 3 days to 14 days to schedule a surgery. So if somebody it's better to prepare them, and it may take 2 weeks. But if the person is a young person, very fit otherwise except the weight, we can operate within 3 days of first consultation. So that's not an issue. That's not a very difficult thing.
Can the patient still continue seeing their primary care physician?
Why not? We always encourage the involvement of your family physician or primary care physician, because surgery is no magic. Surgery is not a miracle. So we just do the surgery, and if diabetes medicines are getting reduced, it's your primary care physician who will decide about it. If blood pressure medicine requirement goes down, it's your primary care physician. So they have to be involved in the whole process, and we encourage that, because they are the ones who know you and your body much better than what we will know.
Yeah, the next question is, there are many potential patients, including me, who are afraid of surgery. How can we reduce or minimize this fear?
Okay, there is no treatment for fear. So that is something that I cannot operate upon. But we can definitely, and this is exercises in that direction only. The idea is that we inform you, educate you, strengthen your beliefs. If you want to, if somebody in the family is very scared about this surgery, bring them along for consultations. They should get information is the best way to remove fear. So get educated, and then talk to me, talk to the team, talk to other patients with surgery. Unfortunately, in obesity, pardon?
Support group meetings.
And support group meetings. So there are support group meetings where people come, and operated patients come, and you can come and attend them and talk to large number of patients at one go. And that is the way there's a way forward, because that's the only way I believe fear can be removed.
Doctor, I believe one is on 25th of...
Yeah, so this 25th September also we have a support group meeting at Wockhardt Hospital. If you wish to attend, you can call up or take an appointment and join us. You're most welcome. Yeah.
They can look for us on the website.
Yeah, they can look for us at the website. So they can go on Wockhardt Hospital website or obesity-care.com, any of the site. And the phone number I already told you is 61784444, and you can take an appointment.
There's another question for hair loss after bariatric surgery.
Yeah. Okay, hair loss is again just like pregnancy, probably the most commonly discussed question. Like, hair loss happens because of relative deficiency. That happens even if you go on a diet. If with a diet you can lose 5 kgs a month, you will have the same amount of hair loss what will happen after surgery. So it's not surgery specific. It's more related to weight loss. So even during dieting, people have hair loss, and the same thing can happen after surgery. But the hair loss after surgery is absolutely a reversible phenomenon. So first thing is you can avoid it by again having enough proteins, by having your vitamins regularly, and that can reduce the hair loss. And second thing is, if it has happened, then you just have to wait out. As the weight loss will slow down, whatever hair you lost, every follicle will come back. So be rest assured, Here, first is hair loss should not happen, and if it happens, then it's completely reversible.
So there's another question. What will be the diet before surgery and how long will I have to follow the diet after surgery?
Okay, there is no diet before surgery. The only concern we have is that most of the people who are going for surgery have a fatty liver, and if it's normal size liver, they actually don't need to go on a diet. But those who have a very large liver, it comes in the way of our surgery. So we prepare them by putting them on a high protein diet for say anywhere 1 week to 2 weeks. But that's it. We don't want you to lose weight. A lot of patients feel that they should go on a diet, lose 20 kgs, that makes the surgery easier for us. Don't believe in all these myths. It's not required. So if you are 120 kg and you want to lose 20 kg to make surgery easier for us, we also operate on 200 kg patients. So it doesn't really matter whether you lose 5 kg or 10 kg before surgery. It's not required. And now the diet after surgery is primarily very simple. The diet after surgery is proteins, proteins and proteins. The more proteins you eat, more weight you lose. I'm not saying that you go on an Atkins kind of diet. This is what our bariatric program, but in nutshell, what I'm saying is that high protein diet helps bariatric surgery and helps you that you do not lose your muscle and you remain healthy.
Yes, I have one question here. Will I have to take vitamins and minerals for life?
Are required after surgery. Vitamin and minerals are required after surgery is because you are concentrating so much on proteins that you are not taking a balanced diet. So if you are not taking a balanced diet, you need to compensate those things which are missing. So what people generally miss are vegetables and fruits. They are focusing so much on proteins, and you always end up eating some carbohydrates, so you eat either bread or rice with it, and so there is hardly any space for vegetables. So you need those vitamins. Now, do we need lifelong? Yes, it's always better to have vitamins and minerals lifelong. And even people who do not have surgery like to have vitamins and minerals. A lot of healthy people, health conscious people now in all over the Western world and even in our country, starts vitamin and mineral when they are 20, 25-year-old. Now here it's even more important. So I think that's not really a big issue. It's like asking whether in a torch do I have to replace the battery every time it runs out. Yes, I mean if you want to run the torch well, you need to replace the battery, or a cell phone. Do we need to replace the battery? So it's the same thing here. It is required and it's not very expensive. They are just about 2 tablets a day, and that ensures that you have no side effect in long run after bariatric surgery. Yeah, Gauri.
Somebody here wants to know that will my insurance cover bariatric surgery?
I think it's so pertinent that today in the most important paper, Times of India, on the front page, there is a consumer forum which has given an order that insurance is bariatric surgery is not a cosmetic surgery, and insurance company is mandated to pay. Unfortunately, what's happening in India is that the insurance guys have been routinely rejecting these claims, citing that it's a cosmetic surgery. They have no valid scientific or legal ground to do this. Every time a patient has taken insurance company to court, majority of the time the decisions have gone in favor of patient. But since there is no central body to force them to pay, they are getting away. Hopefully better sense will prevail, because whenever it is paid, I am sure those patients who have been refused claims in last 16 years of my practice and other surgeons' practice, they should also be compensated for why they have not been paid.
So we have another question. After the first appointment, how long does it take before surgery?
That's what I was saying. It could be 3 days to 2 weeks. Typically, it's about it happens in about a week's time to 2 weeks' time, depending whether we need to prepare them because of their large liver. But most of the time, the liver on the left side is not so big, so we are able to operate most of the patients within a week's time.
What is the cost range of this surgery?
Yeah, cost range varies from hospital to hospital, and also depends on the experience of the surgeon, and the type of room class you take. But it could vary from, say, it can start from, say, 2 lakh onwards, and say up to 3.5 to 4 lakhs. Yeah, usually around in that range. But patient can have a surgery in 2 lakhs if they want it. Your question, sorry.
Yeah, doctor, it's a very unique question. It says that do we have any studies which talk about the average lifespan of pediatric patients?
All right. So what is known is that after surgery, patient's lifespan increases. Now it's very difficult to establish unless we have a very long-term follow-up data. So there is a follow-up data available now from Swedish study they have done 15-year follow-up of patients, and they have found that there is a significant increase in lifespan depending on what diseases they had. So if somebody had a heart disease before surgery, there is 50% less likelihood of them dying of a heart disease. If they had heart disease before surgery, 30% less heart attacks will happen in these patients after bariatric surgery. Similarly, it's a diabetes. So if your sugars are better controlled, for every reduction of 1% of your sugar control, it leads to about 7 years of increase in lifespan. So after surgery, each of the patients have 100% control of their sugars. So it's only a matter of conjecture that this particular person whose HbA1c was 11 will live, say, maybe 20 years extra because they had a bariatric surgery.
So we have a question, can a person have alcohol after the surgery?
Yeah, so alcohol doesn't react with the surgery. So if somebody undergoes surgery, that doesn't mean that the person will drink alcohol and something will go wrong. No, it's not true. But alcohol is empty calories, just like sodas, like Cokes and Pepsis. So if you have alcohol, you are able to have enough extra calories that you may not lose enough weight. So our typical advice is avoid alcohol for at least a year after surgery. And if you feel good with your weight and your body after 1 year surgery, why drink it? But if you wish to have alcohol, one can definitely have it once in a while, maybe once in 10 days or once in 15 days, a drink. But that doesn't mean that person has a half a bottle of alcohol every time that we allow them to have.
How do you select the procedure for patients?
Okay, so there are two ways of looking at it. Every procedure can be offered to every patient. So if somebody is coming to me for a surgery, there is no way that I can match a procedure to a patient. Procedures are never matched. There is no algorithm to say that a person can have sleeve or a person can have bypass and person cannot have this procedure. Alright. But in individual's experience, what we typically offer is this, that if you have diabetes, which is long standing, or if you have a reflux disease where the food comes up at night, I would prefer doing a gastric bypass. And if these two are not there, then I can also offer a sleeve. But ultimately, you are the one who will decide what procedure you want. So my job is to offer the pros and cons of all the procedures, and since we do all the kind of procedures, it's easier for us to give you a balanced view, and then let the patient decide what they want.
How do international patients follow up?
Okay, so almost 40% of our patients are from outside Mumbai, and good number of them are international patients. So all of them are connected to us through phones, through emails, through WhatsApp groups, through Facebook accounts. You ask for it. We are in almost every possible platform connected to our operated patients. We are probably the very few centers in the world could have that kind of connectivity with their operated patients. And we also follow up with them. most of the time patients don't need to come back to us for a follow-up visit. They need to do a certain number of tests every year, certain number of blood tests, and they can share those reports to us through mail. And that's it. And then we can advise them how to titrate their supplement requirement medicine, those vitamin 2 tablets that we sell. And if there is an emergency, they obviously go to their hospital which is nearest to them for emergency management. So connectivity in today's world is not a problem. As I was mentioned initially, video consultation has made it so much easier for patients that we feel as if they are sitting across the table and talking to us.
So we have one question. If patients follow the same diet without surgery, will it help them?
Doesn't happen. Alright, very recently I operated on a 98 kg old man, young man, and his wife came and she said, I don't want surgery. She was scared of surgery or whatever. And after surgery, very intelligently, as most of the young people are educated and intelligent, she followed the same diet what her husband was taking, absolutely the same diet. And after 3 months, the husband has already lost about 18 kgs, while she has lost just 1 kg. And she came and fought with me. What have you done that I am not doing? I am eating the same food. So, the concept is not only the quantity of food, it's also the physiological changes that happens in your body. The hormones change, the intestinal bacteria change for the betterment. And they are the ones why people lose weight after surgery. It's not only the meal size.
How can bariatric surgery help diabetes patients?
Well, there is a lot of science into it. Obviously, I am not talking to doctors today, but there are again the similar mechanism. One is that there is a hormonal changes. So patients who have diabetes have insulin resistance, that their insulin doesn't work, and after surgery, this body's insulin starts working. So that happens not because they are eating less, but because of the hormonal changes that happen because of surgery. Also, the bacterias change. So nowadays, even physicians have accepted that diabetes is a disease of intestinal bacteria and not of pancreas. Pancreas get affected secondarily in these adult diabetics. So bariatric surgery directly affects the organ or the bacteria which are part of our body, which is like an organ within our body, which helps in control of diabetes. And it works beautifully. Every patient who undergoes surgery has excellent control of their sugars.
Sorry, go on.
We'll see one question. What are the other benefits of bariatric surgery?
Well, there are many benefits. Sometimes I feel as if I'm doing something quackery, talking about so many types of benefits. But whether it's blood pressure control, whether it's diabetes control, whether it's joint pain relief, whether it's sleep apnea, people who snore and sleep during the day, that gets getting controlled. There are studies which shows that cancers get reduced substantially in women, especially in women, if they undergo bariatric surgery. This benefit doesn't happen to men, but the hormonal cancers mostly happen in women, so probably that is the reason why it happened. So there are n number of benefits, and what is not measured and discussed is quality of life. People who were not able to run and catch a train are not able to travel in train. People who were not able to squat are able to squat. People who are not able to climb steps, like we had a patient who could not meet her father for many years because he stayed in a building on 4th floor and he was sick, and this poor lady could not climb those floors because there was no lift. And after bariatric surgery, she lost weight and she could meet her father. A very small issue. People who are not going to restaurants because they were ashamed to go to restaurant because of their weight are now able to go to restaurant happily because they don't feel bad about going out or being ridiculed in public space. So I think there are multiple benefits. You can keep counting, and we feel very emotional when these patients come and meet us because they have these issues, these smaller issues which are not discussed in medical sciences.
Sorry.
I have one last question here. on my screen. If a patient has put on weight after many years of surgery, after 10 years of surgery,
Yes.
would you recommend the person to go for a second one or lose weight non-surgically?
Okay. So weight regain is a very controversial issue. Now there can be many reasons why somebody gains weight or regains weight. The most common reason is the dietary change. And we always know, because patients, at least to the doctors, they are very honest. So when they come and they tell us that this is what happened, why I regained weight. I started drinking alcohol, or I love sweets, and I finish a bar of chocolate every day, or whatever it is. But there are very small number of patients who have a mechanical reason, where their pouch has enlarged or a stoma is enlarged, and these are the things which we can rectify. So we try to find out what is the cause of weight regain. We treat that. That means almost 90% of the patient do not require a second surgery. They require counseling by our team and by our nutritionist, and most of them are able to lose their regain weight. But 10% patients, yes, they may need a second surgery, which is doable.
There's one more question, one last question.
Yeah.
Is bariatric surgery safe considering the cutting of stomach to a limited size?
Yeah, absolutely safe. I mean, I think this question has been put at rest long time back. When we started this surgery in 2000, this was the most predominant question. Now, at least patients from Mumbai do not ask this question, because they have seen results in their own buildings, in their societies, in their neighborhood, and they have found that all of them are safe even after 10, 15 years. Gauri herself had a surgery a few years back, and Gauri can share her experience of how it improved her life after the surgery.
Oh, it was a beautiful experience, and I weighed around 130 kgs, and I underwent bariatric surgery in 10 years back in 2008, and life has been a blessing after that. Purely keeping the cosmetic positive changes aside, purely for the health, for the energy, and the positive attitude that one develops because of positive physical health. So it's been a wonderful journey, doctor.
Yeah. Any more questions?
I have one last question here. Can somebody smoke after surgery?
Okay. So smoking has nothing to do with weight loss. Alright. Smoking is not an issue. Smoking is an issue during surgery, that if you smoke, the healing is not that good. But smoking can cause ulcers in that area. So wherever we have found an ulcer, every patient has been smoking. So we advise, please stop smoking after surgery, or if you have been a chain smoker, maybe reduce it by 90% if you really want to smoke. But it is advisable. It doesn't affect the weight. It doesn't neither causes weight gain nor causes weight loss. So smoking is, and everybody knows smoking is bad. Why should somebody smoke? And we all know how bad it is for our lungs. So, statutory warning, smoking is bad for health.
So, is there hope for a pill of helpful bacteria to lose weight?
Certainly, lot of research is going on. But these researches are beneficial for next generation. So maybe 10 years, because once they identify the bacteria, then they need to identify the dose of bacteria which need to be pegged in a pill to have substantial benefit. Then they need to identify specific people who will benefit from those bacteria. So I think, Shireen, that over maybe 15 to 20 years, we will definitely see something. I don't know about weight loss, but diabetes can be cured with a pill, whether it's bacteria pill or something else which we are aware of what is happening in the research side. But definitely a pill will come that you have one tablet and you do not have diabetes lifelong.
So, and do the patients have to have a lifelong follow-up?
It is advisable. It is advisable because it's a lifestyle issue, and the follow-up is only in terms of doing certain tests. If you can come to us, you are more than welcome to meet us. Otherwise, you can send those reports and we can alter the dose of your supplements. Nothing else is required. Lot is made out about follow-up. all that we need to know is that you're healthy, you're not smoking, you're not having alcohol, you're not eating rich food, and you are taking your supplements regularly. Yeah. Any other question?
Yeah. How will a patient know if she needs a surgery or not?
If the weight is affecting your health or affecting your quality of life or your employment opportunities or your educational opportunities, there's the time to look for a consultation with us. Because there are a lot of youngsters who are in 10th standard, 12th standard, are not going to schools because their batchmates make fun of them, or they are not playing sports, which is also a part of growing up. So they need help, and they need a definite help. Just by losing 5-10 kgs or working 4 hours a day in a gym is not the right approach. So I think at any stage, if you're not getting a job because you're overweight, we have operated on so many of the ladies and girls working for airline industry who were not able to retain their job because they were put on the ground floor on the ground duties, and they are again flying. So I think it's not a question of BMI; it's a question of your life. We are not treating computers, as I say. We are treating human beings. If you are suffering, look out for treatment, which is available.
There's a question to know different kinds of bariatric surgeries.
Well, there are almost 50-60 types of bariatric surgeries. Innumerable, I cannot even count myself. All right. But typically, if you are asking this question from India, there are only 2 types of surgeries which most of the surgeons will recommend. It's a sleeve gastrectomy or a gastric bypass. I'm not going into details of them, but go to a surgeon who offers both, because so that there is no bias, and then take his opinion, do a research on the internet. There's so much information available. Discuss it with the surgeon, discuss it with other patients who had sleeve, who had bypass, and find out what works. But overall, it has been seen that bypass in long run has much better results. And so if you can afford it, and if you are ready for a surgery which is more major than a sleeve, go for a bypass. That's my preferred procedure always.
They want to know if you have a personal website where they can have all the details.
Yeah, so at the moment, the website that is providing this information is obesity-care.com, which is the website of a foundation where we have uploaded all these pages for the information. And so it's obesity-care.com, and you can look up at it. Wockhardt website will also very soon have these pages, bariatric pages, so maybe you can get there also. So thank you very much, viewers, and thanks to Gauri for joining us, thanks to Shireen for joining us.
Okay, before we switch off this chat, I would just like the viewers to know a little bit about Dr. Goel. Please allow me to share some more information. Dr. Goel has accomplished advanced and complicated surgeries laparoscopically as early as 92-93, and recognizing his surgical expertise, he was conferred the Fellow of Surgery by International College of Surgeons, Chicago, USA in 1999. He has also been conferred the Honorary Fellowship for Advanced Laparoscopy Surgery in the field of bariatrics. He has performed the first gastric band and banded gastric bypass, that's 4P pouch, surgery in India, and he has conducted the clinical trial of ileal interposition surgery for thin diabetic patients in Mumbai, the results of which were published in a peer-reviewed journal. There's a long list, and
Most of it is available on the website.
Yes, it's on the website, and I thank you, Dr. Goel, on behalf of the viewers for the time you have spent with them.
Yeah, we apologize for initial delay. There were some logistical issues, and this is the first time we are doing this direct communication. Hopefully, from next time we will be on time and we will take your questions. Take care. Bye bye.
Thank you.